Welcome to Behavioral Health Unscripted, the podcast created by Healthcare Capital Advisors and hosted by Jacob Lynch. Join us as we talk to amazing people dedicated to the behavioral healthcare sector, exploring real problems, innovative solutions, and deeply inspiring stories. There's no script, no hidden agendas, just authentic discussions with real people who are making a difference.
There's a number of reasons that I love to talk to Dr. Viner, but obviously he knows the space very well. So anything that I want to know about the mental health industry in general and treatment, he's usually my first call. Been practicing medicine for what, 50 years-ish now?
I think 52.
52 years. So
since 1973.
Wow. So folks, you can read the bio and go through and see all of the different accolades and positions he's held. And very, very well-respected and accomplished psychiatrist. Do I say that, or are there 10 different titles to call you?
So I'm a board-certified psychiatrist, and I'm board-certified in both psychiatry and neurology as well as forensic psychiatry. And I also have psychoanalytic training. So I'm trained both on the neuroscience end of things and the psychoanalytic, intensive psychotherapy side of things.
Wow. Yeah, and you not only were very gracious and hospitable when I visited your place, I felt very welcomed, but also very educational. You were telling me things. Obviously, I'm no clinician, as everybody that would watch this knows, but things that I'd never considered, like when I saw the art therapy or music therapy or other things in your facility there. You were saying, some people have trauma before they could speak, so words don't really do it. You've got to find another way to really connect with them or help them get that out and process it. And I was just blown away. And it's one of many gems I've heard from you that I just wasn't aware of. A lot of us that aren't clinicians don't think about such things. So you've always been very helpful to me in that regard, and also very gracious with me. So I do appreciate you. But again, love to hear the background kind of from your story. You said 1973 was when you started, okay? So I guess I would ask to start with what got you into medicine and what else were you considering?
Oh, sure. So kind of two things really got my attention as a teenager that directed me towards medicine. One was that my best friend, his father was a pediatrician, and back in those days, a lot of docs, particularly pediatricians, practiced out of their house because, the kid's sick at 1 a.m. and mom brings them over and, all that kind of stuff that, having it downstairs in the modified garage was a better way to organize your practice. So we would hang out, in his office. And he just really, impressed me as a person who loved being a doctor. He just loved it. He was always interested in people and, just was totally energized by, what the privilege of being a physician offers to people. And so that really, got my attention. The other thing, which, probably a little self-revealing in a grandiose way, was so in Hebrew high school, we're reading about the work of a tremendous rabbi sage who was the Surgeon General, essentially, for the Ottoman Empire, Maimonides. And Maimonides said that, who was he was a physician and a rabbi, scholar, judge, all of that. And Maimonides said that to be a physician is to be the finger of God. And what 16-year-old boy doesn't want to be the finger of God?
I was going to say, that'll do it. Yeah, for sure, right?
So those two things kind of came together for me where being a physician seemed to be the path that I wanted to be on. The other two choices I had was, my father had a very thriving business, factories. He was in the paper industry, made cartons and displays and, things of that nature. I wasn't particularly interested in that, but I did like and had a history in childhood of being in the factories and walking around and, having all that. And I think that kind of implicitly geared me towards not just being a practicing professional, but also being a medical executive and kind of running stuff, you know. But the love of my, childhood and teenage years was actually baseball. So I was a very successful baseball player, and I grew up. For high school, I was in Nassau County, which at that time was the third, best baseball league in the country, and had a lot of scouts involved. And in fact, my high school coach had played for the Mets, and was kind of networked with that. So when I graduated high school, I had the choice going into professional baseball, and that's what my father actually wanted me to do. You know,
Wow.
but being the great scholar that I was, I had the option of going to Harvard, Yale, or Princeton, because of baseball. Okay,
Uh-huh.
and I went to Yale because Babe Ruth said it was the best baseball field other than Yankee Stadium in the whole country. So that's why I went to Yale.
Now, see, that's what I was going to ask you. You just mentioned Babe, and I thought you had said Yankees before, but you were saying Mets were your connection, your tie here with your coach. So which one
Yeah,
were you?
yeah,
Is it this is all in New York, correct?
yeah,
To
of course.
set the
Yeah,
stage here, okay.
yeah, yeah. So he was with the Mets. You know,
And you were a Yankees or a Mets fan?
Mm. We were actually Dodger fans
Dodgers,
because
Brooklyn
we'd
Dodgers.
grown up in
Yeah,
Brooklyn. You know,
right. Gotcha.
My
Now,
father's
why did
first job, after the Navy, was as a vendor in Ebbets Field. Yeah,
wow, goodness. Those are the days when I wasn't there, but when I watched them and videos and pictures of that, I'm just like, it's a different world, different lifestyle.
yeah,
I wrote, when I had written you something, talk about what else you were considering. I think I wrote boxing potentially or rabbi. Now, I know rabbi was a consideration for you once you're done with
yeah.
medicine. I didn't know if it was a dream back then.
Well,
And then the boxing, did I get that confused with maybe
eh,
your brother or
no,
something?
no, no. You're on point for both. So
Oh, okay.
the rabbi part was, so my parents offered me when I was about to be bar mitzvahed. They said you could have a choice. You could have a party like your brother, or you could spend the summer in Israel. Which do you want to do? Knowing my parents, they could never give up a party. So I said I'll take the summer in Israel. And of course I was right about that. But when I came back from that summer in Israel, I got off the plane and said to my parents, I want to be a rabbi. And my mother said, you're going to be a doctor. And that was the last time we ever talked about
Uh, that's good.
it. But then
So
she
why
was,
was I even asking you about your choices or what you might have wanted to do for a career? I mean, it was given to you. You're going to do this.
exactly.
Once
But then
mom
she was
tells
so
you.
disappointed when I became a psychiatrist, you know. And when people would say, how's Jesse doing? What's he up to? She'd say, he's an MD. She wouldn't say he's a psychiatrist. So then 20 years later, I say to her, Mom, you know, now the neuroimaging and the neuroscience is showing how, talking to people in psychotherapy and treatment actually changes the structure and function of their brain. It's amazing, that, conversations changes brains and minds. So then she would tell people I was a neurosurgeon, you know.
It's so good.
My parents were
It's
hysterical.
funny
Yeah,
that the generations before, whatever they've got in them, just flows through. And then they put it onto you and so forth, and it continues through generations if you don't take the time to learn what tendencies or biases you have. I had a conversation Father's Day or the day after with my folks recently, and just I've done a lot of work on myself over the past couple of years, knowing myself, knowing God, a few other things, and um, spoke with them for 3.5 hours, longest phone call we've ever had, and
yeah,
was
nice.
talking a lot about things that I was recognizing. I'm not ever mad at them. I love them. They were great. They were perfect. They're wonderful. They've been married 55 years. Everything's wonderful. I just mean there's things that subconsciously were passed down to me that you don't realize until you take the time to learn yourself, right? And so
Right.
I've just been very into all this and learning what feelings are again in my mid 40s. I think the last time I really accepted that I had a feeling was probably 6 or 7, 8 years old. Like it was a long time of being a man that was callous. Um,
Yeah.
anyway, you reached the subject there of neuroscience and what some of the advancements and so forth. Why don't you tell us a little about what you currently do in treatment, um, business, and then what you've seen happen over the years, what's happening, and what you think will happen.
Sure, will do. I'm the CEO and Chief Medical Officer for two practice organizations. The first one is Yellowbrick, and Yellowbrick is a provider of partial hospitalization services and IOP services with or without living in a supported apartment. We own an apartment building, but professional services other than what we consider home health care services occur separately about 1.25 miles away in downtown Evanston, which is University City, home of Northwestern University. And Yellowbrick started in 2005 and has evolved with a mission of providing world-class professional care and personalized customer service. And our commitment to that, our following through on that, has actually brought us into emergence really as a premier national referral provider. 2/3 of our patients come from across the country, and they tend to be people who are only emerging adults. Yellowbrick serves really 16 through the 30s, and they're people who have not had sufficient benefit from capable community care, realizing that community care tends to be provided along the lines of medication treatment, and then those psychotherapy treatments which are supportive, educational, skills-based in nature. And the people who tend not to benefit from that are people who have had life experiences and have neurobiological vulnerabilities such that their brains actually can't process information until something has happened that helps to have their brains be better regulated and their self in a more safe, secure, kind of coherent, integrated experience. So Yellowbrick's private pay, and our length of stay tends to be in the 6 to 8 month range. And these are young people who are going to be dead or disabled if something transforming doesn't happen. So the
Right.
stakes are
Very
extremely
serious.
high. By the time people come to us, they've tried other things and it hasn't worked, and they're really feeling their backs to the wall. And they're also feeling very disappointed and often betrayed or abandoned by the healthcare system as it continues to evolve in directions that kind of commoditize care and depersonalize what it means to be a suffering human. So we're really committed to being the antithesis of both of those.
And doing a great job, right? There's I believe I've read about wonderful results and outcomes from your treatment.
Yeah, we have a very rigorous outcome research platform. We just recently published a book that describes our model, including the outcome. And about a third of our patients, maybe approaching at times up to 40%, have a transforming outcome, which for this population means that you've actually given them back a third of their lifespan, because these folks
Wow.
are going to lose, the research shows they're going to lose 20 to 25 years of their life, not necessarily by suicide, but by the pervasive, insidious effects and the lack of self-care for people with serious mental illness.
Sure.
About 50% are much more improved symptomatically, and we see our deliverables as increased resilience and increased risk management skills and increased daily functional capacities, adaptive capacities. About 50% of our patients leave with significant improvements in each of those areas, but we know they're still vulnerable, and life, has a lot of slings and arrows to throw at them. So we worry about them, but we've done what we could for that period of time. And about 15% tell us to go to hell, they're not ready.
Well, we all think that originally, right? We need the help. But
Yeah.
the piece you just mentioned about think you said 15%, and I'm sorry, you said 15% tell you to go to hell, but the vulnerabilities and so forth. And remember you telling me it's intentional that the people that do need the housing live, a mile away, and so they have to walk or ride or bike or do whatever they want past all those
Right.
temptations or stimulations or whatever is in the environment that you have to in the real world, real life. So as a young person trying to seek treatment and improve yourself, that's good practice, right? I'm getting treatment, I'm learning the skills, and I'm still dealing with the troubles every day.
Yeah, thank you for reminding me of that part of our model. So we're an open therapeutic community model, community integrated model, and there's two reasons for that. So one is neurobiological, which is that if you don't have a real choice, including all the bad choices, the parts of your brain that need to change don't light up on fMRI. So between our residence and our offices in downtown Evanston, there's at least a dozen places where you can buy alcohol. There's probably 50 places you can buy drugs. And you got to make a choice, 26 times a day to not buy alcohol, or 100 times a day going back and forth not to, buy and use drugs. And that's pumping neurons, in the reward center of the brain, the ventral striatum. And when people make the wrong choice, most places kick them out. We bring out the cavalry. We have a whole, architecture and workflow that really tries to strike as the iron is hot kind of moment when people, make a risk-related choice. The other reason we're set up as a community integrated program, and it goes back to your comments earlier about trauma. So all of our patients have cumulative and occurrence trauma, and those kinds of issues live in the brain networks in the right brain, which is a nonverbal part of the brain. And in order to be allowed the privilege of accessing those deeply vulnerable experiences, you can't establish the relationships in a way where you have power over these people. So we take a position of we're really consultants in their lives. And they can hate being here, they can not want to be here, but if they're willing to be here and willing to allow us to have a relationship with them where they're willing to be open and vulnerable, that gives us access to parts of themselves that the language in the literature is it's access to the known unknown. We don't end up discovering anything that they don't already know, but they didn't know it in a way that's usable or that has an adaptive access for them. And so you can't have power and authority over them. And the whole struggle of moving from teenage years to adulthood is to really be able to reclaim your authority and reclaim your own, sense of power in the world. And so if we have power, if we're the ones holding the power, it's antithetical to the goals of treatment for this population.
Sure. Yeah. And for that age group, for your population, obviously, them learning about themselves or learning vulnerability and the good stuff's on the other side of that awkward feeling. It has to be a challenging, an uphill battle for them, but great once they figured it out, I'm sure.
Yeah, it's a paradox of human development that the way in which we become stronger is by integrating our vulnerabilities.
Right. Amen.
So I should talk about the second practice organization, which is Synchrony Brain Health. And that essentially is a practice that we spun off Yellowbrick's neuroscience division and created a separate practice that is local and is in network with the major commercials and with Medicare. We wanted to make those neuroscience services available to a broader population. All Yellowbrick patients get Synchrony services, but Synchrony has its own kind of census from the local community. So Synchrony is providing TMS, neurofeedback, direct current stimulators, psychogenomically informed medication treatments, EMDR, somatic treatments, art therapy. All of those treatments have a neuroscience basis for increasing self-regulation. So Synchrony is a neuromodulation, general outpatient psychiatric practice. And
That
so that's been up
is
and running for about 2.5 years,
that is in network, correct?
and it's in network.
Yeah. Okay.
So we have
So,
two platforms. The PHP IOP with or without residence is private care, private pay, and Synchrony is neuromodulation outpatient practice that's in network.
network, yeah. So if I want to come get my brain scanned and figure out why I overthink or procrastinate or whatever is going on up there all the time, that's where to go. Synchrony
Right,
Health.
and we'll give you the Brainsway H7 TMS helmet, and we'll give you
Okay.
neurofeedback and the Alpha Stim, um, you know, direct current stimulator and whatever else.
I love it. Well,
And we'll take care of you,
yeah, I love that. I can't wait. I'm gonna try it someday. So we've got about 5 minutes. Here's what I would love if you could do for me. If you could tell me some of what your, past, present, future, some of the challenges you've had in this business or in this industry, and some of the, successes, things you're optimistic about. And then I want to just end it with a couple rapid fire questions, about you, about Dr. Biner personally.
So, to be very candid about it, I think the mental health industry is under a lot of pressure, a lot of strain. I think that's particularly in the private pay sector, but not only. I've never seen more emails saying we have openings than ever. And a lot of programs that, I have friends and colleagues in are losing money. Thank God we're not. But a lot of places are really struggling and on the ropes. What's that about? Particularly since COVID, I think it's accelerated, and I think particularly since the entry of private equity into the mental health space that has increased the number of programs. Since Yellowbrick started in 2005, there's probably 20 times more programs,
Wow.
as there were back then. And so there's an increase in supply, and those programs are tending to, again, be within that strand that they're doing capable things and ethical things, but it's a kind of a standardized treatment that doesn't necessarily meet the needs of a lot of people. So there's a lot more programs. I think telehealth has diverted the level of care that a lot of people would otherwise have been recommended to. And these are self-recommended referrals to BetterHelp or systems of that nature. And I think that has put the program space under stress. And I also think that for the private pay sector, the culture has moved. The culture has moved in a way that healthcare is experienced by most people as a right, and that their insurance should pay for it. And there's a resentment of people having to go into their own pockets to pay for the care that they actually need. We encounter that a lot because people have been in insurance-related programs prior to coming to us, usually on average 3 or 4. I also think that changes in society. One, there's a mistrust of all authorities, and I think the integrity and respect has kind of broken down, and the movement towards democratization of information and authority, which has many benefits. I think it's negatively affected people's willingness to seek professional care and accept professional recommendations. They don't trust us anymore. As a psychiatrist, I always say, like, the only place where you can really still be respected as a doctor, is in court. When you're giving
Right.
expert testimony,
Yeah.
they treat you like you actually know something, that they don't.
Right. That's where your opinion's most valued
Yeah,
these
the
days.
last thing that I think, again, is cultural in nature is when we started Yellowbrick and we said to parents, this is probably going to take 4 to 6 months or more. Parents often said, I guess I'll have to work 2 or 3 years more. And, this is my kid, or, gee, I was hoping that inheritance, was going to go to something else, or, whatever. Now, this generation of parents, 20 years later, doesn't seem to have that same affiliative focus towards their children. Not all of them, of course,
Sure.
but I think there's something different in this generation of parents that has affected, what money means to them and what it's for.
Sure. I mean, it's good insight regardless, just that the culture changes in general, how they affect businesses within the space, right? Behavioral, mental health.
Yeah, synchrony is actually on the positive side of some of those changes, where I think people are much, much more open to neuroscience and what it has to offer. Maybe they over-idealize a little bit technologies, but we do have effective technologies. TMS, as an example, has a 50 to 100% better response rate than getting one medicine for depression.
Wow.
And there are, and I think people are looking for alternatives to the traditional medication plus supportive psychotherapy, which, only about 50% of people get a 50% benefit. So that leaves a lot of people still suffering and impaired. Everything we do in both practices, Yellowbrick and Synchrony, is research-based. We're early adopters, but the data has to be there. We have a professor at Northwestern Medical School, a tenured professor that's our director of research, and every single group, every single intervention we do is vetted by her for research.
Yeah.
Yeah, I always say she has the best critical judgment of anyone I've ever met about everything except husbands, which is me.
Oh, you're a charmer. You'd be easy peasy, I'm sure. Easy spouse. I've always heard about, and it's a great reputation that you have. The clinical excellence that is talked about in Yellowbrick and Synchrony is world renowned. So, no doubt what you're saying there. You're doing the right things. I wouldn't expect anything different. Unfortunately, because I am using a podcast studio and tried to schedule everybody accordingly, I am out of time. But I'd love to have you back, and we'll go through some of the other questions and some of the more personal life stuff as well, so we get to know you. But thank you so much for your time, Dr. Viner. I appreciate it. Hope you have a great Friday and weekend. Look forward to speaking with you again.
You too, Jacob. I know you're doing God's work.
Thank you, sir.